that they call it ICSI. Yes, ICSI stands for intracytoplasmic sperm injection. Yes, and to take us through this conversation today is okay. She is an embryologist with a decade of clinical experience. Help us break this down. What exactly is ICSI?
Okay, like you said, it's an acronym for intracytoplasmic sperm injection. And like the name implies, intracytoplasmic, inside the cytoplasm. So it's an IVF procedure which involves the injection of a single sperm cell into the cytoplasm of the woman's eggs to achieve fertilization. So what ICSI does is it helps to bypass any problems that the sperm may have traveling naturally to the egg to be able to fertilize it.
To the eggs. What could impede the movement of the sperm to the eggs?
Okay, the man might have low sperm count because the higher your sperm count, the higher your chances of conception. So if that count is low, WHO gives a range of 50 million to about 200 million per mil. So if anything lower than that could impede conception naturally.
When does a couple need an ICSI as a treatment option for infertility?
Okay, like I said, ICSI seeks to solve mainly the problem of male infertility. So low sperm count, poor motility, poor morphology. I told you about the count. There could also be poor motility because ideally when you give us a semen sample, we should see about 50% and above of those sperm cells moving normally. Normally, I mean fast and progressive.
Yes.
So you could see some sperm cells that are sluggish.
Yeah.
They might even die off before they get to the egg.
Okay.
Some are moving backwards instead of forward. You know that's not going to be able to achieve anything.
Yeah.
Exactly. And we'll also look at the morphology of the sperm cells, the shape, because that is very important in being able to fertilize an egg. The head of the sperm has to be able to dissolve the outer layer of the sperm of the egg to get into it. So when we have more abnormal sperm cells, it is always very difficult to achieve fertilization. So ICSI helps to solve all of these problems by picking one sperm cell that is healthy, looks good,
And
has
active,
good morphology,
yeah.
exactly, and we inject that directly into the cytoplasm of the woman's egg to achieve fertilization.
What are the pre-process the couple would have to go through prior to ICSI's treatment?
Okay. ICSI treatment is not in isolation on its own. Like I said, it's part of the IVF procedure. So it's just like the regular IVF procedure. The couple comes in for consultation. They do their initial assessment where we do the blood work for both the man and the woman.
Yeah.
At that point, the man also gives us a semen sample that we analyze to give us a story of what the sperm is like.
History.
Yes. So when they come for a results review, it's at that point that the IVF physician will tell the couple whether they will need this ICSI treatment, depending on the results of the semen analysis.
Okay, you talked about a process. How long would it take from consultation to pregnancy?
Yeah, usually it takes about 4 to 6 weeks.
Okay, 4 to 6 weeks.
After the initial assessment, then they come again when the woman sees her period for the stimulation. They start the stimulation process that usually takes around 12 to 14 days before we retrieve the eggs. And after the retrieval, then it takes another 5 days before we put back the embryos into the woman. So roughly about 4 to 6 weeks.
How successful has it been going forward?
Yeah, ICSI in itself is very successful. I mean, ICSI will fertilize about 50 to 80% of eggs injected. But the pregnancy rate would also depend on other factors, including the quality of the woman's eggs. You know, it takes two to tango. You can't have the sperm in isolation. You have to inject it into the egg. So it would also depend on the age of the woman, what's the quality of her eggs, and whether she has other infertility challenges herself. So that's how it works. But with fertilization for ICSI, it's usually very successful.
Like we talked about age, yes. Is age a determining factor for successful ICSI treatment?
Yeah, like I said, but that's mostly on the part of the woman.
Of the woman?
Yes. So as our age increases, like I said,
reduces.
yes. So you could have lower rate of fertilization with such eggs. The even if they fertilize, they might not develop into embryos. So yeah, age is a determining factor for that.
All right. Percentage of ICSI in Nigeria.
Oh wow, we actually see a lot more of these clients than even the normal IVF. So, and you know, our society, male infertility is not something our society really talks about, but a lot of couples actually present with these problems, this challenge. So I would say out of the 100% of clients that we see, about 60% of them present for ICSI treatment.
Okay, so let's also look at it from this perspective. Like you did say, a lot of men they're either shy to accept the fact that they're having fertility issues. How do we begin to pass this message? How do we begin to let men understand that when their wives are not getting pregnant, it is not always the woman that has the issue. Sometimes it could be the men, and they should begin to seek for treatment as well.
We just need more information to go out there. Like we would usually tell our couples when the women come alone, we tell them you need to bring your partner because the problem might not just be you. So we need to see both of you together to be able to go forward with this treatment. So I think just getting the information out there more will help the men to understand.
Which is exactly what we are doing here on Fertility Focus. We're trying to create the awareness, we're trying to sensitize the policy on the fact that infertility is not only common to the woman, the men as well could have fertility challenge. Treatment process, how long would it take from consultation to pregnancy?
Yeah, usually it takes about 4 to 6 weeks.
Okay, 4 to 6 weeks.
After the initial assessment, then they come again when the woman sees her period for the stimulation. They start the stimulation process that usually takes around 12 to 14 days before we retrieve the eggs. And after the retrieval, then it takes another 5 days before we put back the embryos into the woman. So roughly about 4 to 6 weeks. Of course, ICSI comes at an extra cost besides the IVF.
Okay.
So that could be a challenge for some couples, but it's still quite affordable if you can afford IVF. That little token on top for ICSI shouldn't be a problem, I guess. And then the eggs could also be damaged during the course of the injection. So that's why skilled personnel should always do it. But if they are done correctly, the chances of that happening is just about 1%.